Pitchers, if your shoulder's hurting when you throw and you don't know why, don't guess. Today, we're breaking down the most common shoulder injuries in baseball, how they show up, and what you should do if you're dealing with one.
Welcome back to the Mound Ready podcast, the show where baseball players, parents, and coaches learn how to protect their arms, build real strength, and get back to dominating on the field. I'm your host, Dr. Dominic Rangel. Let's jump into today's episode and get you one step closer to being mound ready.
Do you want to know why shoulders get beat up in baseball? Well, the shoulder is one of the most mobile joints in the body, and that is honestly a blessing and a curse. With every pitch, you're generating thousands of degrees per second of rotational velocity. This means your muscles are working overtime to help stabilize your shoulder. Add any type of poor recovery, mechanical flaws, or weakness, and something's going to break down. Here are the 6 most common injuries I see in the thrower's shoulder. First and foremost, rotator cuff irritation and/or tear. I had to put this one first. This is by far the most common. The rotator cuff is a series of 4 muscles that help to stabilize your humeral head in the socket. The 2 muscles usually involved are the supraspinatus and/or the infraspinatus, but not always the same time. If it's the front of the shoulder, it shows up as pain during or after throwing, especially with the overhead motion, reaching behind your back or even across your body. If it's the back of the shoulder, the pain is usually only with the layback position. Each one has a different cause based on what aggravates the pain, but you have to address them similarly. Minor strains or irritation can heal with proper load management. Bigger tears need structured rehab or surgery. In some cases, the surgery is kind of warranted. The second most common is labral pathology, or also known as slap lesions. These injuries involve the ring of cartilage that helps to stabilize your shoulder. There are various reasons why this is happening. Pitchers with labral issues can feel clicking, popping, or deep joint pain. They often tend to lose their velocity or control, and in some cases can respond well to rehab, but others may need imaging or surgical consults. There are specific movements and tests that we do in the clinic to help tease these out. The third most common, capsulolabral injuries. These most of the time happen because of repetitive stress or traumatic subluxation. Well, guess what? Baseball pitching is repetitive stress, i.e. consistent throwing, causing laxity in the shoulder joint. There are, of course, times when people dive for the ball and the shoulder pops out and it goes back in. It's called a subluxation. This is when the capsule and ligaments that surround the shoulder get stretched. Think of it like stretching a rubber band. It never really goes back to the same length as before. The athletes at that point usually complain of pain, instability, or a sensation of the shoulder slipping. These athletes usually benefit from stabilizing the shoulder through cuff and scapular work before ramping back into velocity. If it's traumatic, then sometimes surgery is the best option. It just depends on every single certain situation. The fourth most common, little leaguer shoulder. This one's really specific to the younger throwers, kind of age 9 to 14. It's a growth plate injury in the upper arm. In the kiddos, the bone is the weak link and can take the stress before the muscles and other structures give way. These kids usually have pain during or after throwing, and it's always along the side of the shoulder. It's very non-specific. Sometimes you can feel, hear, popping along the shoulder, and if it's caught early, rest, rehab, plyoff progressions, and a guided return to throwing works well. The process for this can be super long and drawn out. That's why we want to try and catch it early. If it's ignored, it can become a season-ending injury and potentially require surgery, which of course nobody wants. Fifth most common, thoracic outlet syndrome. Numbness, tingling, heaviness, arm color changes, or aching in the arm, especially late in games or after multiple innings. This is more of a nerve and a vascular issue, often caused by compression in the shoulder or even in the neck. It's tricky and hard to catch, but with the right hands-on care, posture and mechanics work, breathing management, it's manageable in some cases, but the severity of the symptoms is really what determines the best plan. Sixth most common, lat and teres major strains. These are super powerful muscles. They help you decelerate in the arm into layback, accelerate your arm during the acceleration phase, and then decelerate again during the follow-through. When they're strained, you feel pain in the back of your shoulder or under the armpit, especially with hard throwing or lifting. These are becoming more common as people are throwing harder and more often. Treat these like you would a hamstring, progressive loading, controlled volume while you're ramping up. How do you know when it's time to take the injury seriously? If the pain lingers for more than 3 to 5 days, tingling and numbness in the hand, if your velocity is dropping, and if you're throwing and it just doesn't feel right anymore, these are obvious signs that your body's asking for help. When you have these things, what do you do next? Each one of these injuries needs a specific rehab plan because they all have different healing timelines. Generic banded routines just aren't cutting it anymore, and those are honestly more of a warm-up than anything anyways. Over the next few weeks, I'm going to be releasing a deep dive into each one of these injuries, show you what causes them, how to fix them, and how to keep them from coming back. If you're a pitcher or you work with one, you got to subscribe to this channel. This series is all about keeping the arm healthy and the velocity up.